Well, good morning. This is our special day after Veterans Day Coffee with Community Services. All of 12 people have logged in thus far this morning, so we'll see how we do by 11:03, 11:04-ish.
Like a second Monday. They might be sluggish.
It is. It is kind of like that.
What cruel joke is this? 2 Mondays in 1 week?
That's right.
But it's also then our second Friday.
Yeah.
Oh, touche. Nice.
Well, it's good to see that some of you that got your COVID boosters on Wednesday in the office are still with us. And your flu shots, too. All right, we'll get started here in just another minute or so. Not a ton on the agenda for today. All right, we'll get started here. Good morning, everyone. This is John Decker, the Director of Community Services at Alta California Regional Center. And this is Coffee with Community Services for November 12th. I have told folks previously that we are recording these meetings, and so these meetings are being recorded. I will say, though, I don't have confirmation yet that we have posted any of the recordings on our website. So I'll make sure that we get an update for everyone by next week related to that. So a few things to go over today. We're going to be talking about the survey recently that we put out related to service provider readiness, effective December 1st, related to the vaccine mandate. We're going to talk about our COVID numbers for our regional center. We're going to talk about the rate study presentations that the Department of Developmental Services is putting on. And we're going to talk a little bit about kind of some situations that we're dealing with related to services in the Tahoe area. And as always, if there are questions that you have, don't hesitate to put questions in the chat box, and we'll make sure that we try to get back to you guys. So first off, certainly want to introduce the staff that we have here today. So we have our Associate Client Services Director, Johnny Jean. There's Johnny, and we have, who else do we have? We have Shirley this morning, and we have Denise this morning from Community Services as well. And oh, sorry. And I also wanted to talk about the performance contract and the board meeting. All right. So first, just again, I wanted to go into our COVID numbers as I typically do in the beginning. One of the things that I also took a look at, which I will talk with you about, is like a little bit more of an analysis of our clients that have passed away. So as of July 6th, and July 6th being the date when we saw our big surge, our last big surge start, and the Delta variant kind of take hold, we have had 294 positive client cases. I am sad to report that we have now had another death, which I believe is our second one in 2 weeks. So we've had 7 client deaths related to COVID, and we currently have now 3 clients that are in the hospital. So our hospitalization numbers went down because one or two of the clients that was in the hospital actually ended up passing away. Of those that have passed away, I will say it is a mixture of individuals as it relates to vaccination status. Certainly would not be able to get into all of the details regarding people's medical histories, but we certainly just want to say that to illustrate that maintaining all of the precautions that have been recommended by CDPH, by all the regulatory bodies, we just can't stress it enough, because we are all aware that individuals with developmental disabilities have had worse reactions to COVID than individuals without them. So I wanted to touch on that. Additionally, DSPs, we've had 106 DSPs that have been reported to us to have contracted COVID since July 6th, with 1 death. And then for our own staff, we have had 19 cases. This is also a number that's increased recently, and 2 deaths of our staff as well. Okay, thank you. The next thing I wanted to talk about was the survey that was released to service providers related to readiness for taking additional clients effective December 1st. And Jean Onessi is with us as well. Since I canceled Jean and I's meeting this morning because I was working on another project, this will be the first that I think Jean has seen these numbers too. But we just got the survey results back in, and it's only like 4 or 5 days worth of information. We think we're going to get more. I think we got about 60, 70 responses total, and would love to, we had 180 responses for our hiring challenges survey. So we'd certainly like more responses, but we also understand that, people that are just telling us no, that they're not going to be able to accept additional in-person referrals, they truly don't really need to fill out the survey, because we're only really interested in that data for this survey. So with that being said, I am going to share my screen. This is like partial data, but I want to just give folks a picture of what we were kind of looking at doing with all of this. So Denise do you see a Microsoft Excel spreadsheet? Yeah, okay. And so this has been kind of de-identified. Your vendor numbers are on here, but but the names of your companies aren't. And so just wanted to give folks an idea about the numbers. So Gene, you can see the service codes that are here. So like, for example, we've got 2048 companies. So, early autism treatment program. And the hope is, folks, that, we give this information to the service coordinators that work under Jennifer Bloom, and we can be able to provide them with information about who's going to be able to take new referrals, effective December 1st, if we have, for example, another 048 company that says that they're not going to be able to. And that would apply to a bunch of our other ones. And with that being said, I'm also going to welcome Jennifer Bloom, our Associate Client Services Director, who is also with us today. So going through here, looking at some of these different ones, we've got a couple 510s. And these are, I'm only filtering the answers for people that said that they would be willing to accept in-person ones. We can also do this via whether or not people would be able to do remote ones. I think we've got 5 transportation companies that are represented on here. A public transportation company, 1 supported living agency, 1 of the family home agencies, and then, as normal, because we have, just a vast number of residential service providers, we've got a number of residential service providers that have gotten back to us. One of the things that we mentioned was that we would be really looking at our vacancy list, in essence, between now and like December, just making sure that we've got everything as tight as possible when it comes to what availability that we have out there. And part of this, to supplement it, this information as well is also very helpful. So what the plan is we're going to let this survey go until, I think we said, the end of the day on Monday. And then we will be creating a PDF of this document that we share with our service coordinators. So our service coordinators can, scroll through, and then they can also see which counties they would be able to work in as well. And I'm doing this on the screen like I'm still sharing it, and obviously I'm not sharing it anymore. But that's one of the things that our service coordinators would be able to do as well. So this was kind of what Lori had envisioned when she said she wanted to get a handle on like what our availability or readiness is going to be. All I would say is that if you did not get an opportunity to fill out this survey yet, I would really like you to do so. And it went out via email to everyone widely. And if you just, again, haven't got a chance yet, please fill it out. And what I will do before this is over with, well, actually, let's see. I think I need to do it myself because I don't think anyone else here has one. But if anyone has a link to the survey handy and can drop the link into the chat box, again, not the results of the survey, but the actual survey itself, that would be great if we can have someone drop that in there. Thank you very much. So any questions about the survey? And I see the Brianne indicating that they don't have a copy of it. So we'll see if we can get that link dropped in there. So with that, we also mentioned that we were going to be putting out a survey for our supported living providers. And again, in that survey, we're looking at a little bit more in-depth information. We are actually holding off to release that survey until today. I just wanted to give a little bit of time to stagger it. And also, we recognize that when it comes to supported living providers, we're going to be tracking this basically every day until Thanksgiving, and then probably the week after that as well. So it's going to be a day-to-day type thing as far as availability. All right, so that is related to the surveys that went out. The next thing I want to share with folks is we do have a board meeting, and that is on the 18th, and you can go to our website, and if you type in board of directors or board, it will immediately take you to that area where you can get the link for the meeting, you can get the agendas for the meeting, you can get the information that's going to be presented as it gets closer. It's moved up a week because of Thanksgiving, so it's just going to be next week. So what that means, though, is that we did a kind of a full court press to make sure that we got the feedback that was provided to us into the performance contract. And I am really pleased that not everyone would be aware of this, but our provider advisory committee this year actually submitted a number of different ideas from some of the different work groups that are part of our provider advisory committee. And we were actually able to integrate those into the plan for our agency for this next year. So, I mean, that's truly a direct way that you as service providers can impact the work that is done at the regional centers by doing things like making those types of suggestions. And so again, I'm not going to spoil anything until we get an opportunity for our board to take a look at it next Thursday, but just wanted to share with folks that we have got our draft performance contract for next year written. Lots of new, very interesting items in there. And again, just appreciation to our service providers for reaching out to us, giving us items to put in our performance contract that were so well thought out too, that we really were able to not necessarily cut and paste, but we were able to really capture the full ideas that were presented to us. So again, just want to thank folks for that. And I think this really needs to be a real annual activity for us. And I think next year we'll start maybe a little bit earlier, maybe more like September instead of October. But again, just would really love to have more and more of that feedback from you all related to what activities you want to see the regional center doing next year. Any questions about that? All right. So the next area that I want to discuss is the rate study meetings that were held by the Department of Developmental Services. And I first off apologize because this is going to require a little bit of audience participation, because I'm assuming that at least one of you went to one of the trainings that was done by the Department of Developmental Services that have occurred so far. And so I wonder if anyone would be able to share what, from a service provider perspective, what they heard, and then what questions do we as the regional center really need to still find out for our service providers? And so do we have anyone that attended that and that would be willing to share? Apparently not. Apparently we did not have anyone that has attended the rate study meetings by the department. Well, in that case, I am going to have to just encourage everyone to do that by sharing the information about the upcoming meetings. So I am going to navigate. Oh,
Uh, if if no one really has gone to those meetings, I'll make a couple comments just to help you out, John. But if you could go ahead and share the registration again, and they're recorded.
I'm gonna just share it while you're talking, Eric. I'm gonna just have it in the background for the upcoming meeting next week.
Sure.
And my understanding of DDS meetings is always that the last meeting is the best meeting. If there's a number of community meetings held, you always want to go to the last one because that's when they've heard the comments from your peers. Go ahead, Eric.
Yeah, if you could put all that information in the chat, that'd be good. And I'd echo John's comments. I'm registered for the last one because I was part of the group that got the pre-meeting where we got a preview of the presentation and gave feedback to DDS. So I didn't want to participate until the final meeting. So unfortunately, if somebody else is gone, I'd prefer them to give, but I can give an update on what I saw in the pre-meeting and what I think your question was of what regional centers need to be paying attention to. But I'd highly encourage folks to either attend the training themselves live or watch the recording. You really do. If you're an executive in your company, you need to be doing this. I'll just put it that way, my personal opinion. So
Hey, Eric,
as far as feedback.
Eric, real quickly, Pam Haney is on right now, and she did attend the training and does have a question. So, Pam, would you mind unmuting yourself if you are able to, so we can kind of hear your feedback, and then also we can make sure that we get your question down since we've got our staff here.
Sure, I am unmuted. So my my question was largely related. I mean, as it relates to my organization, Progressive Employment Concepts, I'm thinking about TDS, but in general, one of the messages mentioned was that service codes that are not explicitly mentioned in the rate study are going to be excluded in the implementation of the rate study. Now, in reading the rate study itself, right, TDS is a subcode, like ours is connected to 055. So our assumption was that perhaps it would be related to that in some way, that the changes related to 055 would then affect any subcode under that. But it doesn't, it sounds at least potentially like that is not the case, one. And two, kind of, do we know what the future holds with that, right? How about after the hold harmless, period and things like that? Because I know, so I'll just share one of my big concerns is that, our costs continue to rise as it takes a number of years to implement this. The numbers are going to be very outdated and not meet the need. And our service code would actually receive a rate reduction if it what's in the rate study as 055 applied to our TDS. So that's kind of a convoluted number of questions there, but
no, perfect. And so let's break this apart just real quickly. So regarding TDS, I certainly have seen in the documents provided by the department that TDS rates were not included in the rate study. With that being said, I think the question would be then, well, then if they're not included in the rate study, are they then going to be included in the hold harmless clause? That would not make sense to me. It would not, because the hold harmless is related to rates that are in the rate study, to my understanding. So, and I want to say that, again, we are well aware that I am not an employee of the Department of Developmental Services, nor Burns and Associates, or Health, whatever company they are called now. But that being said, that's an area of clarification that I think that we can get specifically. We've had so much efforts to focus on tailored day services. That's been a big push over the years, the last several years. And so, keeping things going in that trajectory is what we're interested in. But, if it ends with 4 years from now, we have, big rate cuts for service providers, it's not going to be helpful to our clients at all. So, Pam, I think that's something that we will certainly seek clarification from. I know there's going to continue to be follow-up meetings. We're going to be doing a meeting with the chief financial officers and the community services directors together with DDS so that we can kind of go over all the questions that came up in the big meetings, because there was 105 regional center staff, I think, or 120 regional center staff on their meeting. Okay, so thank you very much, Pam. That's something that we certainly need to follow up with as well. Eric, so did you want to just share a little bit more broadly and again, maybe continue to encourage folks that this would be something that is worthy to participate in these meetings?
Yeah. By the way, thank you, Pam. It's really good to hear other folks. And I've already given my comments to DDS. So there can be an echo chamber of the really smart folks that already in the meeting keep giving our feedback, but then we miss things. Probably for one reason, we've been a part of the whole process, so you become blind to things you haven't already thought of. So we really do need new folks that are running services to be in these meetings and giving feedback directly to DDS or through a representative. So just please. So Pam, you're absolutely right. That is a concern that many of us have identified and brought up, that tailored day services, which is what TDS stands for, tailored day services and several other service codes are not explicitly in the rate study, and that creates a big problem. The rate study does not address 100% of the service codes that need rate reform. And so by not including certain services, other services that are usual and customary, for example, and other things are not included in the rate study, and to move the whole system forward without including those rates is problematic. It's incomplete. So that's one that we've identified, and many are saying we might need to go back to the legislature to get this done because they're saying it's not in the text. So there's that. I want to add to that to make sure that I'm going to share with this group the feedback I've provided, or I've heard other folks provide that I think are relevant. I would add to that the rate study doesn't necessarily prioritize services that we would classify today as innovative, HCBS compliance, or person-centered. The rate study was really looking at the previous version of services provided by the Department of Developmental Services and regional centers, without prioritization or bias towards more compliant or more innovative service models. It doesn't include a preference towards employment. It doesn't include a preference towards HCBS compliant services. It doesn't do a lot of those things. So Taylor is another one of those examples where that's something where we'd want to move forward to, but it's excluded in the rate model. So there's a concern about how can the rate study move us forward and not actually move us backwards by creating better rates for services that we maybe want to reform. The question is, how can we amend the rate study implementation plan to foster the kind of services we want to create, not the services that we have created that need to be reformed. The other question that I had written down that I was able to find is that I already talked about things that were excluded completely from the rate study. There are other things in the rate study that we've all identified that may be wrong, that generally affect a whole class of services that we never felt, even through the comment period, was taken seriously or updated because the rate study was never going to be implemented. Well, now it's going to be implemented. And so there's serious reforms that or assumptions made by some of our services that provider groups think are wrong. And we don't want that to be locked in and cemented in for the next several decades until we can do rate reform again at some future time and have that solidified in a rate study round. So how do we update and amend the rate models to correct issues over the implementation period? That's one, and we don't know if we can. We're concerned about that, and I won't go into all of the ones that we have issues with, but there are some major ones. The other thing I think we need to be aware of, and you need to watch, is how they map your service codes. Not everybody can be sure today where they're going to map the service you provide today to the appropriate rate model. So you should watch that, and if you should be asking, or I think we should be asking, if you want to appeal that map once you eventually figure out how they did map you. Maybe they mapped you back from what you did, when you were vendorized 10 years ago, but maybe your vision for your service is going in a different direction. You want to appeal how they're mapping your service code. So I think that's something that I've added, like how can we be a part of that process? With that, I recommended that when they give your rate increases in September, that they actually show you your map, because if you participate in the previous rate increases, you got Excel books that some people understood, but a lot of people didn't. And so can they provide something to the provider in an accessible format to show how they are mapping, what assumptions they are making about your vendor service, about where you're going, so that you can understand that, and then you can maybe appeal or change that with the regional center. And the last one is, it's not really a question, but it's something you have to watch at, is what they talked about with bundling and unbundling. That is significant for certain services. If your service either bills for multiple subcodes or codes for one service, or in the rate model has multiple service codes that you're bundling, they're talking about bundling and unbundling service. Folks should be paying attention to that, and we need to be able to address that. It's not all a financial question. Some of this will impact operations. For example, if a rate was unbundled currently, if you're able to bill for one service, two different rates, let's say one for mileage and one for the service hours, your mileage could increase and decrease based on the usage of that client service, right? It can scale to meet your needs. If in the rate model it's bundled, there is no ability to bill separately for mileage. You can't bill more for one client and less for another client to meet your rate. So that might change how you have to operate your service, because it's all inclusive in your new rate. So maybe there's some folks that are receiving services that now no longer are feasible, reasonable for you to be able to do, because you can't bill that mileage. Does that make sense? That's just one example of bundling. Those are my comments, John.
Thanks. And so two things. One, first, I think there might be a little confusion. The rates are not coming in September, coming in April. So
sorry. April. If I said September, no. In April, there's those new rates, and I'm wondering what we get. Explaining the new rate and then the assumptions behind that new rate to the provider in April. Sorry, April.
My understanding is that 6 weeks. There will be 6 weeks that elapse from when they are given to the regional center to when they need to go on for us to start writing authorizations. And then it would be, the month of April, you'd be writing those authorizations so that your end of April, beginning of May billing, it shows that rate increase for those that are able to qualify for that rate increase. The other thing, just of course, the second that Eric started mentioning bundling and unbundling rates, immediately I thought of the transportation providers. And as Eric used that as an example, we don't know exactly what that's going to look like, but it is extremely complex when you have, again, the vast different ways that transportation is paid for through the state of California. But transportation was one of the ones that was noted about the difference between the per mileage cost and, like, for example, some of the other administrative costs back at the office. So again, that this is when it comes to the bundling and unbundling, this is what I was explaining to Olivia and Jean, is really going to be important that we have our community services specialists that are looking really closely at these, because they're going to be able to also ask questions of the service providers. The mapping aspect of it, that where services will land, there's some real broad categories out there, and your program may not have been intended to be an employment training type of program, but over the years may have morphed into doing more of those types of things. And so it's just very important that when we come down and take a look at it, our service providers, there's so many service providers in California that are going to have input related to their own rates. There's going to be so many provider groups that are going to have concerns about the way that rates are, categorized, as Eric just mentioned. And so just know that DDS has a huge task between, now and the time that we start getting rates as regional centers, and we will do everything within our power to make sure that we get, the rate increases in the way that they are required, by statute now. With all of that discussion about the rate study and the implementation, as Tanya Nally put, they have the upcoming one. I was sharing the screen. If you go right to DDS's website, on the very front page, Michelle Ramirez shared with us last week that you can see all the upcoming events with DDS. And so again, we just encourage folks to hop in there and see what's going on, because this is going to be a huge change to the way our service system gets funded. And it's just so important to understand how it's going to impact all of your businesses. My gosh, this is the first time I've looked up to see how many folks are here. 49 people. That is not too bad for a second Monday. Is that what it was, Denise? We called it a second Monday? Okay. So with, again, all of that said, is there any other questions related to the rate study that you would want, regional center staff to be following up on? And if there is not, what I would encourage folks to do is, if you think of one later. Oh, I see a hand up. Yeah, go right ahead.
I was just curious to know if, with this upcoming rate study, is there anything on the books to help cover inflationary costs? Inflation's at a 30-year high now. Also, some of the stuff that we're facing, with the Great Resignation that's happening, and kind of modernizing our wages to make, kind of incentivize more workers to come into our workforce.
Thank you. Yes. So that was a big question that Eric had actually raised for quite some time, which was, are the rate models going to be based off of the 2018, work that was done, or are we going to be looking at something that is, updated? And so my understanding is that it will be updated. And the thing is that right now, if it was updated off of something 3 months ago, as opposed to 3 months from now, that could have significant differences for folks based off of inflation and everything else that's going on. So I know that that is part of the feedback that people have been providing, and I know that they are looking at calculating it, but the extent to which they are able to fully be able to do that, again, it is something that they're taking into consideration, certainly. And would you mind just sharing, sorry, Cody, your company that you work with, so folks are aware of it?
New Beginnings for Exceptional People. We're an SLS agency.
All right.
Hey,
So, Yeah, go right ahead.
This was something that wasn't clear in the original PowerPoints that I viewed, but I was told by the department in the final version of the presentation, they were going to make this clear. The rate tables will be updated. So if you go to the rate study and you are able to find, which I think everybody should do, find the previously issued rate tables for your service, that table or understanding will be updated. Now, it wasn't clear to me if they're only updating the wage data because it assumes a lower minimum wage, so it need to be updated at least with the higher minimum wage. I'm not entirely sure to what depth they're going to update it. I don't believe they're going to update, say, productivity factors, but they might update like IRS mileage rates, for example. So exactly how they're going to be updated, we're not sure, but the big ones, they said they will be updated. I don't know if we'll see them before we see our rates. I don't know, sometime between now and April, not September, that they'll update it, but they have committed to update them, yes.
Okay, thank you. I will. I'll be attending the one on Monday, so we'll ask questions then as well.
So this is the slide that they will be sharing with folks on Monday when they attend the training, and it does talk about the fact that they will be updating the rate models. But again, that's why these service provider training specifics are so good, because you can think of your own questions based off of this, based off of your own company, and make sure that you ask it of the department as well. And I am going to just drop a copy of the presentation for folks. I know not everyone's able to make these things with DDS, but again, certainly think it's important. And this is in the chat now, which is a copy of the presentation that I was just sharing my screen to show. I've got one more topic area, but first we've had Marty, another one of our community services specialists, join us today. Hello, Marty. So we are currently dealing with, service provider challenges related to staff hiring and retention. I guess I get to now start using the phrase "the Great Resignation" because it's very catchy, and so certainly running into that. And as we expressed earlier, lots of concern in the supported living world. We did have the closure of Tahoe Community Integrations. Tahoe Community Integrations is closing this month, and Tahoe Community Integrations serves a number of individuals with day programming and with ILS, Independent Living Services, and also is a member of our Provider Advisory Committee. And so we at the Regional Center certainly very concerned about making sure that there are services available up in that area. Wednesday, we held 2 town hall meetings with clients and family members from the Tahoe and Truckee area, just to talk about the other opportunities for services that are available. And again, we had our associate client services directors on there. We had our executive director on there, our executive management team. And we also, which to me I felt was certainly the most effective, had our service providers on there as well. So we had John and Janine from On My Own that were there. Michelle Ramirez from On My Own was there. We had some folks from a couple other programs that are opening up and active in that area as well that participated. And so again, just wanted to share with folks that we really want to try to make every effort to make sure that our entire catchment area is covered. We are certainly aware that there are lots of hiring challenges that are really specified as well in the Tahoe and Truckee area too. So part of that, and then just to give folks an idea of our efforts, we're going to be running an ad actually in the newspaper up in that area for people that are interested in becoming vendor to service providers or possibly working with one of our service providers. It's not something that we typically have done as a regional center, but recognizing just the depth of the service needs in those areas. And also, wanting to make sure that if we do have folks like On My Own or others that are expanding more into a certain area, that we've got enough folks that can work for them, but also that there's enough referrals to really support services in that area. Gina and I for years have worked at looking different services all throughout our catchment area, and sometimes it can be a challenge just to support those vendors that move into an area. I remember developing a parent training program in South Lake Tahoe that we didn't really have a need for after it was all said and done. And so again, with that, just talking about those resource needs, I was able to this week connect with basically the director of community services for the state of Nevada that works in Carson City. And so one of the things that I'm looking at is trying to collaborate with her and some of her staff to see if there's things that we can do, because we share that whole area right there. And there's a good ability to do some crossover between the two regional centers. Excuse me. Well, there's a rural regional center out of Carson City as well. And so looking at seeing what we can do to kind of support that entire area collaboratively. So that's, again, just a little bit of our efforts as we're looking at trying to support the Tahoe area. So with that being said, it is 11:39. Jean, do we have anything else that we need to share with our service provider community this morning? Nope.
I don't think, I think the rate study and the survey and everything is where we're all concentrating on. So I don't really have anything to share. Except maybe Nicole Smith will be going out on her second half of her maternity leave. And so if you need any assistance, just contact myself or Patricia Sonano or Olivia. We have coverage set out. Just contact me if you're wondering who's covering her cases while she's out.
Thank you, Jean.
Mhm.
I'm sorry, and this last question that popped into the chat makes me feel like I want to have one of our associate directors, maybe I'll have Jennifer do it. Just give us a little update on self-determination. I heard from Michelle Johnson yesterday that things are continuing to increase. So
Oh, yeah. I love the random thought, Dennis. Random thought department. So, yes, we have 29 SDP participants. So we are super excited for that. That's a big milestone. And I was just informed on Wednesday that a parent was on our SDAC committee meeting, and she said that she hopes to be number 30. She's almost there. So things are moving along really well.
that's
I'm looking
excellent.
at yeah. Has anyone?
So looking at Dennis's question there, alternative services and self-determination kind of go together like two peas in a pod, really.
Yes.
So you
They
want
do.
you guys just got done doing those presentations. Do you want to just share a little bit about that, Jennifer?
Sure. We had two, let's see. We've had two trainings so far, two provider trainings for SDP. Our SDAC committee gathered a little ad hoc committee together with some regional center staff and also SDAC committee members to talk about how to educate and provide a little orientation to providers when it comes to SDP. So just helping providers know what questions they might be asked, helping them be able to prepare for questions, or if they're approached by an independent facilitator or a SDP participant to engage in services. So we had an overview presentation. We had two sessions so far last week, and then we have another session on November 16th from 3 to 4:30. That session is also recorded. So there's a recording on our YouTube site. And I should have that handy by now. If Brianne is still here, Brianne Burris, she's a part of that training and very helpful. So that there's opportunities to attend on the 16th or to watch the recording. And then our goal is also, we had a post attendee survey. We're trying to see if there's anything else that providers are looking for. So based on the survey results, we'll do some lunch and learns, little topics, deeper dives into specific aspects of SDP. But this session that we just did is a general overview. And thank you, Brianne. She says, sure, she's going to put it in the chat in a moment. That would be the recording she's referring to. And there it is. Thank you, Brianne.
Excellent. So, again, as we talk about how services are quote unquote authorized through self-determination, alternative services, again, I don't want to say it's all alternative services, but in essence, it's not like you are tied per se to the service or even in the service provider that would be recommended through the regional center, but rather, through, self-determination and through your planning team. So yeah, I think there's a lot of flexibility that's going to be available to folks that are, utilizing SDP. I want to jump into this question here real quick, which is from Catherine Whalen, which is related to the rate models and the minimum wage increases. And so I'm just gonna share this screen again, and then I'm wondering if this answers the question. So it looks like for April, at least, that they are updating the rate models so that it will be at a $15 per hour minimum wage assumption. And so I think that should cover the minimum wage increases. But again, I think that might be another good question that we can follow up with DDS about as well.
John, my question was more in relation to regular minimum wage rate increases, because rate study aside, when minimum wage goes up, if we have DSPs at minimum wage, it qualifies us for applying for
Okay.
an increase just based on that. So my question was, does one overlay the other, or do we still would do both? Because the rate study isn't until April. So if we applied for the minimum wage rate increase for those DSP, it would still apply for January through April's billing. Right?
Yeah, so I think that would make sense then, that it would need to be done separately. So let's, Shirley, let's talk to Olivia when she gets back. Let's see if we want to make sure that we get some clarification related to that specifically, so that we can talk to the service providers about it maybe at our next meeting, or put out an email because we know it's going to impact folks.
Thank you.
Yeah, no problem. That's why, again, these meetings are great, because it helps us be able to kind of formulate the questions that we need to be asking, not just for you guys, but for all the other vendors that aren't in these meetings. And I have a question about rate wage increases. I think every provider would agree that no one doing direct support should be making minimum wage. That probably isn't the level of work we'd want to support. So what have the conversations with DDS on what a reasonable age for different services would, or excuse me, reasonable wage for different services would be? Yeah, I think there's continuing ongoing discussions with the department at all times about what is needed in order to be able to fund the services for our staff. I mean, one of the things that's been a challenge for the minimum wage increases is that if you pay above minimum wage, then you don't always see those increases when the minimum wage goes up as well. I don't know if anyone else wants to share about any other additional conversations that have gone on with the department related to this, but I think it certainly makes an issue. And we have another one in the chat here as well. Oh, go ahead, Eric. Yeah.
I would just say that the rate study was intended to address that question.
Yeah.
If you ask the department, the rate study is presenting rate tables, which assumes a higher wage for staff that they would say is a competitive wage in the marketplace for that type of work. So the answer, I think, from the department would be implementation of the rate study is implementation of enhanced wages for our direct care workforce. Some of us disagree about the competitiveness of the rates assumed by the study. So I think that's something that we just need to be paying attention to, because there was a competitive wage study done by California Living Network, Supported Living Network, and they propose much higher wages, for example, than what's in the rate study. So it's something we need to be paying attention to. If you don't think those rates are adequate, we'll need to make that case as they implement the rate study. At the time, there wasn't much sympathy to that because it was a $1.8 billion price tag. So the idea of adding money to that really didn't go anywhere. But as we go through implementation, that'll be a challenge to make sure that we're really showing what the rate study assumes our staff are making, if that is actually competitive in the long haul.
Thank you very much, Eric. And I'm just going to share my screen one last time with the information from DDS, just because I wanted to point out something in here, or I should say from Burns and Associates and DDS. And so again, there was a question about whether, we have ongoing pandemic related costs, and is that something that is going to be included in the rate study as well? One thing I note here is DDS included these 5 areas related to rate model updates. And they didn't indicate like to include but not limited to. It's just like indicated just those 5 different areas. So if there are additional areas that service providers believe that they would like to get clarification from the department on whether or not it's going to be included in the rate study, I would encourage you to attend the public meetings that they are holding and make sure you reach out to them and specifically talk with them about it. That being said, it is also a question that I will bring back to those that I speak with as well. And I'm going to go right back into the chat again. Rachel or well, anyone from the program, want to just unmute yourself real quickly and talk about the event that you dropped in the chat box?
Yeah, absolutely. So for those of you who are interested in supporting people to join the self-determination program, you'll know that for most folks, the first step of joining self-determination is creating a person-centered plan. So we are offering a person-centered plan facilitation training that is specific to the self-determination program. So we are encouraging anyone who is interested in supporting people to create a person-centered plan in self-determination to come join us. The training's open to individuals we support, family members, service providers. So the link is there if you're interested in joining. We also are offering another round of that training starting on December 1st. So I will drop that link in the chat as well, but I hope you can join us and support folks to get going in self-determination.
Thank you so much, Rachel. Perfect. And a couple things, so did want to just look at 2 areas, Eric, and we'll just make sure maybe we make it a topic of conversation here in the future, which is, for those things that are not included specifically like TDS in the rate study, what are the hold harmless implications of that, basically? The other one is that question that you said several times, which is for some service codes that were not included in the rate study, and there's a strong belief that they needed to be, what is the method that we get that to happen? Does it have to go back to the legislature? I will tell you, this has been reached out to, the Landerman Housing Alliance has reached out to me because service code 089, which is the housing access services, I think it was considered under one of these quote unquote specialized services that were not included in the rate study. Well, at least I know it is. And so with that, that's a question that's come up as well. And people have asked me. So I will certainly be asking those questions. And if I find out the answers faster than you, Eric, then I'll share them here or maybe vice versa. But let's make sure that we get those ones back because I think those are going to impact folks. And question on there for Rachel. Are you guys going to be recording those sessions for the facilitation training that you guys are doing on Monday?
So we will not be recording that session for folks outside of that training. We will be providing certificates to people who do attend, so it's mandatory for all 4 of the sessions. Okay.
Excellent. Thank you very much. And again, folks, when you do have resources like that are available, I know that the communications committee with the provider advisory committee group has been really pushing to making sure that we've got these things posted on like our website and stuff like that. So please just share all of these types of resources, and really appreciate you guys attending our meeting today, and we'll look forward to talking to folks next week. And again, attend those DDS meetings related to the rate study. It's going to certainly impact all of your work. Happy Veterans Day the day after to folks, and we hope that you guys have a great weekend. And we'll look for, we are doing Coffee with Community Services the Friday before Thanksgiving, so we will certainly see folks next Friday. All right, have a great one, a great rest of your day. Take care.